it's going down, going down, going down. Also here, the way Victor was saying, you have to make sure your hands are not long. Like,
who eats in the dark? Who really eats in the dark?
the space here which it is left here is for the cement to drop. So then in the act, the condom slips inside the part of it.
You hold the tip. Do you know why he's holding the tip? There's this story of this woman. Let me put this light up so Owen can have all of us. So there was this story of this woman who used to work in a hotel, and this billionaire came into this hotel, and he used a condom and he left it in the dustbin. You hold the tip. Do you know why he's holding the tip?
No.
Okay, John.
Now the Mr. Victor is also breathing, so we'll create space for him to breathe. Then another advantage, another importance of holding the tip is when the space here which it is left here is for the cement to drop. Because if you use it, if you just put the condom fully, you might not get space for the cement. Because so they will start dropping down to your girls.
So you're creating space for the cement.
For the semen. Then from here, after you have hold the tip. Now this is my Mr. Victor. So you have to use it.
I can just hold it for
okay. So it's like here.
Teamwork.
Then you have to press this rubber because whenever you are bringing it down, it's going down, going down, going down. Also here, the way Victor was saying, you have to make sure your hands are not long. Like my nails here, they are too long and you will need to take off it. So
why do you think you have to ensure your nails are not too long?
You might cut.
Good. Yeah, because in the process, like you are in a hurry, so you might interfere with it and it cutting without you being noticed. So you just press it until it's kinda it reaches down. It reaches towards near the scrotums. Yeah,
the wall.
These are our balls, and it's not. Yeah. So let's assume that you just you press it until the rubber it finishes. Then you just leave it. So after this, you do your thing.
So you see this space that is left here is for the semen. So from here, what do you do?
You go into action.
Okay, how do you go into action?
I don't know.
I don't know, that's why I'm asking you. How do you go into action?
Just insert.
How?
You just aim and insert.
Of importance is to communicate, because if you insert and she's not wet, then the condom might break. Yeah, you thought I knew, yeah? It's for you to know. So it's important to communicate. Also, sometimes as you push it down, as John was pushing it down, you might be clearing these lubricants, right?
Yeah.
So it might get dry. And if she's not wet in return, it might hurt her or even hurt you. And that might also lead to friction that might tear the condom. And this might lead to zero work. So this, they say, is what percentage safe?
It's 90% safe.
99.9% safe. My entire life I've used this, except when I got there. But it's 99.9% safe. I don't really advise drunk intimacy, because that way it's not safe. You don't know what you're doing. I don't advise intimacy in the darkness. Sometimes some people have insecurities and they want the room dark. If they want the room dark, just make sure you turn on the lights until you do this safely, and explain to them, sorry, I can't really put this on when the lights are off, so I'm going to turn on the lights, put this on, And then, but also you have to be cautious of somebody who eats in the dark, who really eats in the dark. So that is not a safe zone to be. If somebody wants to eat in the dark, that's not a good person. That's omuloji. You know omuloji?
No.
Yeah. Who's omuloji? That's a witch. or a mganga. You know a mganga? Yes, so you have to be careful of witches or mgangas. Do you have any other questions?
No.
What have you learned?
You should have questions.
You should have questions.
Especially at this method.
Yeah.
When you are in the act, does it come sometimes or is it?
That's a good question. Depends on the size of your Mr. Victor and the size of the condom. So make sure you have condoms. This is a standard size actually. It also stretches. So that's why I said make sure you have full erection. And also as you continue being in the act, be cautious. Sometimes it's like, of course, if the woman is wet and this gets wet and your skin is also wet, it might, just like how you slide in mud, it might slide out. So you want to be very cautious. That's why it said it's 99.9% if used, safe if used correctly. Okay, yes, so it might come out, so you want to put that in your mind. It might come out. Any other question?
That's the only question.
Do you know how to use condoms now?
Yes.
Are you going to be using condoms?
Yes.
Yes. Use condoms, abstain, or be faithful to your partner. Okay? But also condoms, even if you are being faithful, condoms are important because there are also other things. Do you know what this protects?
Yeah.
One?
Diseases. Pregnancy.
Unwanted pregnancy or pregnancies that you're not ready for. So this also helps you it saves you from a lot of things. Always remember to have money when you get intimate with anyone, because as we said, you might get intimate with somebody who has STDs. STDs can be expensive to treat. If you don't have the money, you just be walking around and looking at people like because you are paying. Yeah, it might sound funny, but it's not funny. But also, if it comes out or if it bursts, you might not realize, or the lady might not realize, and then you end up with
You end up with the diseases.
or unwanted pregnancies. And pregnancies are very, if you choose to go the abortion way, which I wouldn't advise, you have to pay money for safe abortion. If you don't choose to go the abortion way, do you know what you pay for? Baby diapers. A baby uses 3 diapers a day, minimum. The day they diarrhea, they might use up to 6. One diaper is?
And they pay around
30 shillings.
40.
So 30 by 3 minimum, 90. 90 by 30 days,
2,700.
2,700. That is $27 monthly just for diapers. When the baby is growing, they need to go to the clinic, they need to dress, so you need about, on the minimum in Kenya, about 30,000 Kenyan shillings monthly to be able to take care of a baby. Basic needs, not other emergencies or anything. And remember, it's not just the baby, because the mom is also down at that moment, right?
Yeah.
So you're taking care of the baby and the mom, so she can be able to produce what? Milk for the baby. Because if she's not able to produce milk for the baby, it's also an expense. You have to buy the naan. It's called naan. And naan is one of the most expensive baby products. The naan is the powdered milk. So it's one of the most expensive. So as you think about, just make sure you're using condoms, correctly. Yeah. Anything? John, do you have any questions?
Yeah. So, well, mine is after doing it. So we have already finished the act. So removing condom now.
Is it your question or you wanting to?
Yeah, I need to do it.
So you're done?
Well, I just
Yeah. Okay. Go ahead. Come closer. Sure.
just take it out like this.
Nice. Interesting, John. What do you think?
That's a big
Take it back.
Can you take it back?
Take the condom. Don't be afraid you guys are gonna wash her hands. And condoms cannot be used again, so this is just for experimental purposes or for educative purposes.
So okay, let me first before that. Okay, I have a question for you, but after this. So, or when the mistake that you did, maybe you are maybe you are on top of the girl, so you wouldn't want to remove it like this, because the immediately you remove it like this, you are allowing the sperms to drop, and maybe the girl is on top of you, so the sperms might drop inside in her.
You're on top of the girl.
Yeah.
You even know that the girl can be on top of you. Boy, you're wild! This guy is wild! Wild cat! Okay.
Okay, so that's it. Maybe you're on top of the girl. Now, let's say you are not on top of the girl, you have finished the act. Also, it's not advisable to remove it. That's the correct way to remove it. You remember the same way you are putting it. Now you're gonna use the tissue for hygiene, because you might go back to the foreplay.
Benji, can we get some tissue?
Yeah, tissue and the wipes.
Wandera? Okay, I think we have wipes in the office. Yes. Why do you have baby wipes? Oh, don't worry guys, this is for cleaning tables and also the screen of the laptop. It's not for...
No, another challenging moving this one after the other. Now from here, what you're gonna do is just to hold your at the end of your Mr. Victor. Then you just
I don't Mr. John.
okay. You just remove it slowly. Then you make sure the semen is intact. Okay. Then you remove it. Then you just wrap it very well. You know the reason why we are wrapping it very well. So this one, because you are going to dispose it, and you will not want any kids to get intact with it. You see? So because most of the people are very careless, so they just let me say for instance, like the way you did it, they will just go and maybe throw it outside, and the kids are playing.
Have you walked around and see condoms, used condoms around?
yes.
Yes. So that's what he's talking about.
So after here, also you don't want to flush it. You just throw it at the dustbin. The dustbin, you just dispose it there. Then the garbage collector will come and collect all the garbage and throw it dump it where they always dump it. So from here, just throw it. Then good. Then after there, wash your hands. After washing your hands, then you can go back to your girl. Maybe you can cuddling. Yeah.
Cuddling? Cuddling. You know cuddling?
Yes.
What's cuddling?
So how about long hug?
A long hug. Fale. Take it slow, bro. Okay, so you had a question.
Yeah, I had a question. So let's say you are in the act. I'm not saying that it has happened to me, but I'm just,
It's okay, bro.
yeah, I'm just thinking out loud.
Okay.
You are in the act, and maybe you condom might slide. Also, maybe the size of the condom might not be the size of the Mr. Let's say Mr. John. Then
You can say it, Victor.
so then in the act, the condom slips inside the part of you, inside in your partner. What can we, like in that process? What's the first thing that one should do?
The reason I say don't have drunk sex or don't have sex after using drugs is because you're aware of what's going on. It happens. This happens, and it's happened to me as well. And so when you are doing that and it happens, the moment you realize it, you wanna first communicate, because depending on how depending on how deep the rubber has gone, there have been cases, I've heard of cases of people even going to surgery to remove it if it's gone really deep. But you want to make sure she's very comfortable and you guys try and get it out. If you successfully get it out, probably you had come. So the both of you are probably pre-exposed, because either the semen has gone in, the sperm has gone in, so you might want to take an emergency pill or a birth control pill, which is not the very best for most of these women, but it's the safest way if you're not ready for a baby. But I think that is the first thing you want to think about, because then you're thinking about the both of you, and then the next step would be for both of you to get tested. You understand?
Yeah.
And if one of you is infected, it's important for the both of you to get treatment. But I'm imagining the person you are being intimate with is somebody that you trust. So if they had an STD, they probably had communicated, which we are not assuming. Not everybody is the same. Some people just sleep with people not telling you they have STDs or HIV. So just to be on the safe side for her and for you, don't make it look like it's just how it's going to infect you, but tell her that I want you to be safe as you would want me to be safe. And so what I advise is that we go for a test. Yeah. Just don't go for, the kit test, because I see a lot of people now getting the kit test from the pharmacy and doing the test, and they think they are safe. I've heard of friends who were like, okay, so I don't use condom, what I'm going to do is come with a test. Let's do a test kit. Some of these test kits are faulty. When I used to do, you have my face, eh? Very important. When I used to do counseling and testing as an intern, and also when I finished, they employed me. I met people that were actually older than me, and they were buying the kit and testing, but they couldn't get the kit, so they came for the testing. And this person confessed that it doesn't, because you ask people questions, have you used condoms, do you use condom, how many times, and this person actually, not from knowing, told me that every time he buys kits and then they test, they wait for it, and then when it's ready, if the girl is safe, they have intimacy. Some of these kits have been proven to be faulty sometimes. So what I tell people today, there are people who've been HIV positive and they use the kit and it tested negative. Then they stop taking medication, then they go down, and then they are tested again. So at that point they have to do a blood test. When they do a blood test, they find out this person is HIV positive. So what does that tell you? The kits can be faulty, or maybe the process you're taking to do it. You're not a professional. Why are you testing yourself on an HIV or STD test kit? But again, also these kits, some of them, especially what we have now, they do not show if somebody has STD or is positive for a sexually transmitted disease like gonorrhea, chlamydia, syphilis, whatever. You understand what I mean? So it is not safe to just have some, regardless, even if it's treatable. I started by telling you that having STD is not prestigious, it's not fun. So why would you just rather be safe or HIV and be okay with getting gonorrhea? You understand what I mean? So that is the second step. Make sure you remove it safely, and if it's not removed safely, then seek help from the hospital, and they know how to remove it. Don't force yourself to remove it, because you might end up hurting the woman. And make sure you're doing it also hygienically. If you're gonna insert your hands, first thing is to make sure your nails are cut. I haven't been having sex, that's why my nails are yeah, but make sure your nails are cut, and also your hands are clean, to put your hands into her, because if your nails are not cut, then you might cut through the Mrs. Victoria. And also also, if your hands are not clean, you might leave Miss Victoria with an infection. Understood?
Yes.
Yes. Any other question?
It was that one. Maybe some might come maybe off camera, then I'll ask you.
I have a question for you, and then for you. What happens if you realize the same thing has happened? Either the condom slid in and you came in, or the condom tore and you came in, and the lady says, "Oh no, I'm not going to get tested." They're like, "Oh, okay, give me money for the emergency bill, but I'm not going to get tested." What do you do?
I don't know. Maybe I'll force her.
You beat the hell out of her, force her, eh?
Yeah.
Yeah. Then what happens?
When I realized that it's break, then she doesn't want to go for testing. First thing, yeah, just talk to her, then explain to her the benefits of testing, and also the harmful.
Assuming you have done the explaining, and she's like, "No, I'm not going to get tested for it." Because there are people, trust me, there are people in their 50s that have never been tested. They don't want to be tested.
Mm-hmm.
Yeah.
Yeah, she has the knowledge of everything. No,
Yes,
she doesn't want
yes.
to go for testing.
Yeah, she's like, "No, I'm not going for testing. Just get me money for the EP."
That's a tricky one.
Well, she can just take care of the baby herself.
The e-pill is to take care of the pregnancy. The testing is to ensure that none of you is infected with STDs. What do you do?
Maybe
This is when I take my glasses off. What do you do?
that's a good question, though kind of tricky to answer.
Okay, if you don't know the answer, I can help. I'm not the answer man, but I think today, one, there has been developments in the medical world, and if this person refuses to go for it, well, you could take them to the police, but I don't imagine you want to drag somebody to the police. After explaining to them the importance of it, you can actually, what you can do is, this question I asked one of my friends, and it said, "Okay, I lied to her that I have an infection." Yeah, you could actually be sued for that. But also, I don't think it's narcissistic. I don't like to use this word, but it's a bit crazy to go to that extent. But if you have to and feel the need to, then I don't know, do what you want to do. Let us know what you do in the comment section. But also, there is something called PrEP. Have you heard of PrEP?
No. Yeah, about it. PrEP, it's kind of like when you feel like so PrEP, you take, these are drugs which you take, and it's kind of early prevention of the STDs and the
Yes.
and the
So it's called
HIV.
pre-exposure pills. So pre-exposure pills, actually, I know there are some for HIV, which we imagine is the STD that has no reverse, is not treatable. Right now, there's no treatment for it. I don't know if there is. If you have it, let us know in the comment section. But you want to seek medical attention and explain to the professional that you were pre-exposed and this person refused to test, and you don't feel safe about going about your business without, and they will test you, they will make sure you are on this medication, which is also not pretty. I know a couple of people who've gone through it, but again, it protects you from HIV infection. And for STD, I don't know if there are any preps for STDs, but I think that is the direction you want to take. But keep advising this person to go for testing as well. Yeah, that's why it's very advisable to be sober when you're doing this. Have somebody who's sober and upright in their mind. Maybe you want to close the door. Yes, sober in there, because for somebody to not want to get tested, they didn't tell you about their status. This is a crazy person, and you just don't want to go around sleeping around with crazy people. You understand what I mean? Yeah. Any other questions, John?
I've heard about this the prayers, but how long does they take to?
Actually, it's quite a number of days. I can't remember at the top of my head. I used to admit it, but it's probably like I don't know if it's 3 months. So can you imagine 3 months taking prep for 3 months? It's probably a month to 3 months, and then you go for another testing. Then they clear you. Yes.
That's nice.
Yeah.
Yeah. Good to know.
Yes, so it's very important for a young person who is watching this. Let us know if you had this information. If you did, well and good, share more information that you have. If you didn't, please give us a thumbs up. Share this video to whom it might be beneficial to. What is your biggest lesson from this one?
Well, I've learned how to prevent sexual diseases, and I've learned how to use a condom.
Okay. Great. John, biggest lesson?
Yeah, my biggest lesson is the prevention and pre-exposure for both of you. So yeah, that's the thing that I didn't know that now I know, which it's on top of my head.
So teach your students as well.
Yeah.
We give it to you to give it to others.
Yeah.
Another thing that I'd like to add, quite expensive, but it's important to also in your life practice having lubricants, especially with. I imagine now you probably don't have one partner, so if you're gonna have numerous, then lubricants is good. If they are not wet, then you can use the lube. Again, make sure that they are not allergic to it. Communication is very important in intimacy. Don't force them, like you're saying. Don't force anything. Anything forced during intimacy is considered
Unsafe.
rape. And rape is a crime punishable by law in the court of yes. So don't force anything on anyone. Make sure the intimacy is consensual. Make sure she's right. Make sure you are hard. Yes, very important. Make sure you're hard. Don't just push yourself in. Then you put yourself on the risk of the condom coming out and you being exposed to these diseases. Close the video, bro.
Ladies and gentlemen, yeah, it's good. Hope you all learn. In case of you might ask some question, just put it in the comment section, and Victor will be delightfully humble and answers your questions.
Even you can answer this question.
Yeah, I can. Yes.
But also check out his YouTube channel. Share with John. All the shares on all link of description. Also, the person on the camera. Shout out to Nasri, who's on the camera. Iconic Nas. Link on description. Bro, what have you learned?
I've learned so many things.
Come sit here. As we close.
There's so many things that I don't know if you can finish. Because starting with the condom, there's things that I saw when I see the condom. For me, I didn't have school where I learned this, but I learned it from the streets. For me, the way I take it out, that's where I had I was surprised. That's where I learned. So when I put it in the exact way that you showed, John, that was the correct way. And when I take it out, I usually take it out like this. So when it's like this, I hold it there, and then I just push it out. And what I do is crazy. I don't know if I'm the only one doing it, but I always do this, something like this. If you're from the streets, you know. So like that.
Actually, that is the
That's how I do it.
So you see, that's why.
After
that's
that, then I
important.
use that to put it in.
Yes, tying a knot is very important,
Yeah.
but you also want to be sure after touching the condom, because if the person was infected and you touch the walls, you want to make sure, one, you have a wipe to clean your hands, or a sterilizer to clean your hands, or you go up and wash your hands before you come back and start touching
Victor.
Mr. Babu. In this case.
My other
Yes.
question was, John mentioned that you don't flush it, you just throw it at the dustbin. What is advisable for that?
Why is it advisable?
Why is it advisable?
Why do you think it's advisable not to flush
Not to
before
flush,
even
yeah.
So one, it might cause blockage to the toilets.
Mhm.
Two, the drainage. You don't know where it will land.
Mm.
Because with this, it depends with the place that you are. Because if you flush it, it might go maybe and exposed to maybe where the children are. Yeah. So and the kids will get in touch with it and
They will chew it.
yeah.
Yeah, it's safe. Yeah, I get you. I get what John is saying. Because once upon a time, a wise man told me that when you finish this, you have to know where this goes. Because if you leave it around, maybe a woman might take it, and just go.
So I'm going to tell you a story of a billionaire, why it's really important to know where your condom goes. And a lot of people, and as this woman was cleaning, she knew that this was a billionaire. So she took the condom and inserted in herself and poured everything in herself. A few years later, she went to court and said, this is his kid. And this billionaire swore to his life that no, he's never slept with this woman, doesn't know this woman. And they did a DNA test, and it turned out. So, and again, in Africa, I think this can be used for rituals as well to make you important. You knew this? Yeah, this used to happen a lot. So if a witch doctor finds it, they can use it to make you important. This is an African thing, but let us know where you're watching from and if you know about this. Again, as kids, when kids didn't know about this, so some of the kids would take it and chew it.
Yeah.
You've seen even kids playing with condoms.
Yeah,
That is
when I
what-
was young, I used to play
with condoms, yeah, used condoms, yeah, and
I
it's
can
not,
remember, yeah.
and it's not
I used
safe.
to put air inside
Like
the
a balloon. Yeah, it used to happen. I know it's crazy, but it used to happen. So it's very important for us to just know that to protect the people around us. Because think about it. I mean, if this person had herpes and they were blowing the condom, they would be having like torn lips all over, infected lips all over, and you wonder, where did this kid get herpes from, And herpes, herpes is one of the STDs that you live with for the rest of your life. So thank Allah, thank God that they were safe from it. And so it is very important. And also, like for example, we have a dog here. If Vivu smells this, they might think this is tasty, and they might. So just make sure you know where it's going and you know where it's disposed. Yes. Any other thing? Interesting points, by the way.
Yeah, so I think just like John said, when you have more questions, we'll ask at the comment section. I'll ask, so if anyone, even you guys will ask. I thought you were.
Oh, yeah.
Yeah, interesting conversation actually. What Share with Victor was talking about, like we don't have people who teach us to use these things. Millennial. I was born in that time. I was so young, but I used to see it even being advertised at the television, how to use it, things like that. But nowadays, it doesn't.
How about the three of us look for some funding and walk around, show some teenage people how to use condom? I can get a letter from the authorities, and then whoever wants to collaborate, let me know in the comment section if you are interested. It doesn't matter what you bring, but this should probably just go to this project, teaching young people on how. I'll also talk to some of the organizations. We can talk to our organization, and then we think about moving around and teaching young people how to use condom. We can get donation for condoms and things like this. So this is not gonna be very expensive. But then we just go around, dance, and then because when we dance, they come around. Then we collect them together, and this is how I used to talk against crime. I think you remember. Yes, and I got arrested for it, but now it's really beautiful that now the community is aware of the work that we do. So what about if we think about this project for the next few months? We just do it maybe for 3 months in different villages in Kibera.
Yeah.
Let us know what you guys think about it. Just teach young people on how to use condom and safe sex, and they can have some of these questions that these amazing guys have asked, and even my little brother behind the camera, and then we can just address these things once and for all, and reduce the rate of infection, fight HIV and other STDs.
Yeah.
Here's the video. There's this story of this woman. Let me put this light up so Owen can have all of us. So there was this story of this woman who used to work in a hotel, and this billionaire came into this hotel, and he used a condom and he left it in the dustbin.
Videos, like, share, subscribe, and comment. Peace.
Adios. Let us know what you'd like to hear. If you like the conversation, also let us know in the comment section. If it was trash, please let us know in the comment section. And let us know what you'd like to hear us talk about. This has become more like a podcast. Ladies and gentlemen, see you in the next podcast.
Beanos.